abstinence syndrome that occurs when babies are exposed to opioids during pregnancy. We know that there's a lot of research on this population, and I'm going to go through a little bit of that right now to describe neonatal abstinence syndrome that usually appears within at least the first week and a half, sometimes, as it says, 1 to 3 days, or it can be a little bit longer. So you may be getting, if you're in child welfare, reports for babies that have already gone home, potentially, that begin to have symptoms, and particularly if you are in pediatric care, that you may have this coming in that is a week or so after birth. You see the kinds of symptoms that may appear. We also know that onset is somewhat related to the characteristics of the drugs used by mom and the time of last dose. So we're going to talk a little bit about what that looks like in terms of the characteristics of pregnant women, but want to emphasize that most opioid-exposed babies are exposed to multiple substances, and there's long-term research about some of the other substances as well as those that are exposed to opioids. We also know that there's a great deal of variability about the babies that actually exhibit symptoms of NAS, or neonatal abstinence syndrome, with a pretty wide range of those that exhibit symptoms, and that medication is required in really only about half of those cases. Now, I think one of the encouraging things that we'll hear Sally and Karen talk about in terms of what they find in Vermont is that medications are required in a much smaller percentage of the women that they are involved with, based on some of the interventions that they're putting in place during pregnancy. So we're excited about that. We also know that there are many studies about the long-term impact, and if you look just at the cognitive development of babies that have gone through NAS just after birth, that those are within normal range when looked at in this preschool period up to age 5. There are old studies of heroin exposure from the 70s and 80s that have tracked babies even a longer period of time. And what we know about that is that the environmental context of the family characteristics, did the mom have prenatal care, what other substances were involved